Hearing the word cancer can be frightening. Can you explain the difference between low-grade and high-grade tumors and what that actually means for treatment?
There's benign and there's malignant. Malignant just means that the tumor cells can spread. They can break off from the tumor and then spread to other parts of the body. Okay, that's what cancer is. All right. Benign tumors don't do that. So benign tumors are not cancer. Cancerous tumors, though, have the ability to metastasize or spread to different parts of the body. Now, within the family of cancers, and there's lots of different types of peripheral nerve cancers, there are ones that are more likely to spread and ones that are less likely to spread. The ones that are more likely to spread are the high-grade tumors. These are the ones that have a high probability of metastasizing. Okay, those are the high-grade malignant peripheral nerve sheath tumors. Those are a little bit different biologically, behaviorally. There's completely different animals from the low-grade malignant peripheral nerve sheath tumors. They're still cancer. They can still metastasize, but they tend to do that much more slowly. They tend to do that much further along in the course of their growth. And they tend to grow less rapidly. They're just less aggressive. They tend to hurt, but they don't tend to spread. And so because of that, the management's a little bit different. So if a patient is suspected of having a malignant peripheral nerve tumor, it's important to get a biopsy, like I said before, because the biopsy tells us how we're going to treat these different types of malignant tumors. The low-grade malignancies are treated by taking the tumor out and leaving the nerve behind. Exactly the same surgery we do as the benign nerve tumors, because you want to cure the cancer by taking it out. But since there's such a low probability of metastasis, we don't have to take out the rest of the nerve. We don't have to take out the surrounding muscle or the other tissues. We just take out the tumor. Okay. That's the treatment for the low-grade malignancies. The high-grade malignancies, completely different. Those tend to spread along the tumor. They tend to spread along the nerve. They tend to spread into the surrounding tissues. So if you have a high-grade malignancy, you want to take out that tumor. You want to take out normal tissue around it, whether it's nerve, the muscle, the blood vessels, whatever it's attached to, it all comes out because you're trying to cure that cancer that has a really high probability of spreading. So that's a much more aggressive operation. Okay. And that's not something you can figure out on the day of surgery. That's something you sort out before the surgery with a tissue biopsy. Okay. That's why it's important to biopsy malignant tumors or tumors that are suspected of being malignant. We don't biopsy the benign tumors that are clearly benign because that biopsy process can injure the nerve. But in a malignant tumor, that nerve's coming out anyway, or at least the high-grade malignancies. So again, we're sort of trying to save the patient's life at that point. So the risks of the biopsy kind of are not as important. They're still there, but they're not as important if you're trying to save a person's life. Okay. But if you biopsy a benign tumor and you give that patient a horrible pain complication, that's a real problem. Okay. So again, this is why it's important to have these conversations with your doctor to really try to find out in any given tumor, how best to move forward. What type of treatment do you need to do? Do you need to treat it at all? Do you need to do a biopsy? It can get, a little complicated and there's some nuance there.
All right.